Institute for Health Equity documents and addresses structural inequities and advocates for the promotion of health and well-being in New York City. NIKA LUNN is the program director of the CUNY Institute for Health Equity, and she's here with us today. It's a pleasure having you on the program.
Thank you so much.
I want to find out what this does. What is the Institute, and what is it that you actually do? You do research of health situations in the city?
Yes, we do. So as New Yorkers, we live in one of the wealthiest and most prestigious cities in the world. However, in this city are pockets of poverty, of limited access to healthcare, of lack of access to food. So there are these pockets of inequity in all of this wealth. And in order to address these barriers to healthcare, these structural inequities, the founder of the Institute for Health Equity, Dr. Marilyn Aguirre-Molina, started this program in 2009. And we do research and we help with community-based organizations. We help them get the resources that they need.
When you talk about these pockets, are they geographic pockets? Are you talking about specific areas of special need in New York City?
Yes.
Tell me about some of those in the Bronx, for example. What's an area that requires special attention?
Well, for example, right now, one of our projects is looking at infant mortality and morbidity in the South Bronx. So in the South Bronx, the issue of infant mortality is very high because the level of infant mortality is that of a third world country, and it shouldn't be that way in New York. And so one of our projects is finding out what the stressors are for the mothers and what their birth outcomes are based on environmental stressors.
So once you do that, then what do you do with this information?
Well, we are at the beginning of this project right now, so we're getting everything together. And what we've done so far is kind of look at the areas that we're studying through geographic information systems and kind of figure out what the environment is like in these areas. Are there trees? Is there garbage on the ground? And then the next step is to go and interview the mothers who have had these birth outcomes. And then we go and we distribute this information. It's part of our knowledge transfer core. So after we conduct the research, we distribute it to the appropriate sources in order to create change.
Health awareness.
Health awareness and ultimately policy change.
So you would go back to this, once you do your research and you come up with a set of findings, you take it back to the community agency organizations, right, and they disseminate the information? And
they disseminate the information. They use it as a tool for advocacy efforts. They use it as a tool for fundraising efforts. And hopefully, if it gets into the right hands, which we're trying to assure that it does, ultimately the mortality rate will go down. Mm-hmm.
This is part of CUNY, right?
This is part of CUNY.
CUNY is in the title here, the CUNY Institute for Health Equity.
CUNY is in the title, yes.
So, but CUNY is doing this not just for students, this is for the community.
It's for the community. Because CUNY is such an integral presence in all of the boroughs. CUNY has a presence in all of the boroughs. So while we're situated here at Lehman, we're actually part of the larger CUNY system. So the resources that we can gather from are CUNY-wide.
So tell me about the program. When it got started, how did you get the funding to get something like this started? How does Dr. Aguirre get CUNY involved in this?
Well, the start of the program was in 2009. That's when the Institute opened its doors. And I'm not 100% sure how she got the initial funding, but I know that we are grant funded. We're a grant funded organization. So based on the projects that we do, that determines what grants we pull from.
Mm. So you're not during the course of a year, you might be doing several of these research projects and applying for several different grants to pay for it?
Yes. We don't focus on one area. We focus on multiple areas of health inequity. So right now we're currently working on maybe 4 different projects and looking for more to continue working.
And who is we? When you talk about, how many of you are there and who's doing this work?
Well, we're housed in Lehman, in Gillette Hall, and we're actually under the Department of Health Sciences. So we work with some of the professors that are in the Department of Health Science, and we also have a staff. So the executive director is Dr. Aguirre Molina, and then I'm the program director. Lakeisha Brooks is the program associate, and then we have a lot of interns that also help with the projects.
Give us an idea. You mentioned 4 projects that you are working on. You already mentioned one of those projects in the Bronx, in South Bronx. What are the others? What are the kind of things that you're researching right now?
Well, so the South Bronx is one of them. Another project that we're currently working on is called the Photo Voices Project. So some of these community-based organizations that we work with are youth-based. So they help the urban youth in the community. And what we did was we gave these urban youth video cameras, and we said, take these and document what you think the health inequities in your neighborhood are.
Wow.
So they came up with, I mean, they were fantastic. They came up with things like poor sanitation, lack of nutritious food, food deserts, sexual violence and different social issues. And what we did with that raw data was we made it into a video. And so right now we're working on that video, and then we're going to also disseminate this video and give it to our community-based organizations to use as a policy and advocacy tool.
So do you do events to involve the community?
Yes, we do.
Are you involved in health fairs and this kind of stuff?
Yes, we also do that too. We are wide-reaching. Another one of our projects is the vending machine initiative. And as part of President Obama's Healthcare Reform Act, he stated that we needed to put nutritional information on vending machines so that people could know what they're buying before they buy it. So our interns did this great project, and it all kind of culminated in Food Day, which is a nationwide annual event to promote healthy eating and sustainable farming and things like that. So we had a tabling event outside of Schuster Hall to involve the community. 10 community organizations participated. We gave out information, we gave out healthy snacks to Lehman students. We did surveys in terms of what students eat at the vending machines. And so that was a big community event that we participated in.
How do you arrive at, okay, there's an area that we need to research? Is there input from the community? Are these agencies? You work obviously with a whole bunch of different agencies.
Yes.
It's not the institute, it's it's like a chain reaction, right?
Right, exactly. So we gather our information from our community partners. You know, we have, we're under the Health Sciences Department, so some of the projects that we're working on is research that some of the professors are doing. We can also work with different hospitals in the areas based on what they're interested in.
So what is your role as the director of the program?
I oversee all of these programs, and I make sure to get done what needs to get done.
Are there like special challenges that you confront that, oh wow, this wasn't anticipated, but here is this whole new area that just opened our eyes that we should be looking at? Does that happen?
Well, honestly, I've been here for 3 months. Today's my 3rd month at the Institute for Health Equity. So the only challenges so far for me have been learning the system and making sure that everything is done according to plan. So it's just been that usual learning curve of learning a new job. But in terms of the challenges presented through our grants, I haven't seen anything too major.
And what is the response that you get from the community when they know that some people are actually looking at their health problems and researching it in a scientific way? Are they welcoming of this situation? Are they, oh, look, I don't have time for this, I got a job and I got things to do? Or?
Yes, no, from what I've seen, they are. You know, we have 14 community-based partners throughout 14.
All over the city?
In the Bronx, in Manhattan, and in Brooklyn.
Okay.
Not in Queens or Staten Island. So, you know, we work with those entities individually and together. And we also work with the university. We work with students, we work with professors, we work with scholars. So the response has been very good. and we're trying to keep it going.
Okay, so once you determine that there's this area that you need to research, and for example, we hear here in the Bronx, asthma is a very serious problem because of the pollution in the Bronx. Is that a situation that you guys have encountered or have looked at, but again, how does the issue get to you?
It depends on the issue.
I just brought an issue up to you. Is that how it happens?
Yes, actually, it is how it happens. Somebody is interested in researching an issue. We look for funding for this research, and then we do what the grant specifies. But yeah, it's working with different agencies to see what their issues are, because while we're an institute and we're an independent entity, we are also very connected with both CUNY and all of these community partners. So, we look out for them, and whatever work that we can get done, we do.
So if people want to participate, contribute, help the Institute in some way, how do they get a hold of you?
They can go to our website, cunyhealthequity.org. We're located in Gillette B033 in Lehman College. Or they can email me at nlunn@cunyhealthequity.org.